Hello, my name is Al-Husseini, and the title of my research study is an investigation of neonatal sepsis at a tertiary hospital, the isolation, identification, and antibiotic sensitivity patterns of pathogenic bacteria at Muhimbili National Hospital in Dar es Salaam, Tanzania. This was completed in the fall of 2019. So to begin with some background, neonatal sepsis is clinically defined as a type of neonatal infection and specifically refers to the presence of bacteria in the bloodstream that can manifest in clinical ways such as meningitis, pneumonia, and more. Tanzania specifically has one of the world's worst infant mortality rates with a 38.2 infant deaths per 1,000 live births, of which 30% of these deaths can be attributed to neonatal sepsis. Tanzania has also failed to meet the WHO's Millennial Development Goal of reducing infant mortality rate by 2/3 by the year 2015. Now, on to the objectives of the research. Firstly, which was to determine the types and frequency of pathogenic bacteria responsible for sepsis at this hospital. Secondly, to establish a deeper understanding of antibiotic resistance patterns of the bacterial isolates that are responsible for the sepsis. And thirdly, to determine any associations between different clinical factors and sepsis-positive blood samples to suggest methods of faster diagnosis. Now, to give a brief overview of the methods and procedures used to conduct the study, the neonatal blood samples sent to the lab were determined positive or negative for bacterial presence using a Bactex FX40 machine. All positive samples, which totaled 104 in the study, were then cultured on different sorts of media, including chocolate blood and McConkey's agar, and incubated for 24 hours. After this, bacterial colonies were gram stained, and then the gram-positive bacterial identification species was done using catalase and coagulase biochemical tests, whereas gram-negative organisms required the use of API20E biochemical identification strips. Upon identification, bacterial samples were then prepared for antibiotic susceptibility testing through plating on Mueller-Hinton agar. After 24 hours of incubation, the zones of inhibition were measured for determination of the degree of antibiotic susceptibility. Lastly, patient records were accessed to determine important clinical information such as birth weight, gestational age, and more. Of the 104 sepsis-positive blood samples, 17 different species of bacteria consisting of gram-positive, gram-negative, and fungal isolates were found. The mortality rate varied greatly amongst these organisms, with the Pantoea organism contributing to almost 60% mortality, whereas the most recoverable was the coagulase-negative staph with 26% mortality. Of the tested neonatal clinical factors, the only one where there was a significant difference between the averages of positive and negative samples was birth weight of the baby, indicating that positive samples were significantly more likely to come from lower birth weight patients. Percent resistance to common first, second, and third line antibiotics greatly varied, with an average 85% resistance in the use of first-line treatment, an average 54% resistance in second-line drugs, and an average 14% resistance in third-line drugs. And lastly, in this setting, the mean number of antibiotics used per patient was 3.4. However, 10% of patients in the study actually were prescribed 6 or more antibiotics in the single hospital stay. Previous studies on neonatal sepsis done at the same hospital provide a useful framework for being able to analyze the results of this study and compare it to historical data. Firstly, in terms of the bacterial prevalence, a study from 2012 isolated 7 bacterial species that were responsible for causing neonatal sepsis at the same hospital, and a 2014 study isolated only 5. Obviously, these numbers greatly differ from the 17 unique species that were isolated in this study, contributing to sepsis and mortality, which indicates that there's a far greater array of pathogenic bacterial species in this setting than previously indicated. Additionally, looking at the historic data on antibiotic resistance from the past 13 years have shown a significant increase in the percent resistance of 3 important commonly used drugs. Gentamicin, ceftriaxone, and amikacin are all drugs that have grown in percent resistance by at least 10% since the previous study in 2014, which indicates the seriousness of antimicrobial resistance in being able to combat these deadly infections. In conclusion, improved infection prevention and control measures must be implemented to decrease the prevalence of these rare bacterial species contributing to the high rate of sepsis and mortality in this setting. Resistance to commonly used antibiotics has also shown to be growing significantly, indicating the looming threat of resistance that may render these infections much more difficult to manage. For this reason, clear guidelines for the prescription and administration of these antibiotics and management of neonatal sepsis must be implemented to prevent and slow the growing rate of antibiotic resistance. Thank you so much for listening, and please feel free to contact me with any questions you may have on the study.